Hello, everybody. My name is Anita Arno, and I'm the Director of the Office for Health Equity at DC Health. For too long, we have discussed health and other disparities in silos. Similarly, our attempts to think about solutions and other opportunities for change have similarly been explored through silos. Indeed, because of the persistent link between poor outcomes by race, ethnicity, and socioeconomic status, it has felt so disheartening, leading us to conclude, for example, that perhaps these differences are inevitable, and perhaps they may be even natural, maybe related to our genes. We know, however, that these are errant assumptions. The evidence base shows clearly that race is not biologically based. The overwhelming majority of evidence demonstrates that amongst the majority of folks who are humans, what we see is that people who may look the same have more differences amongst them than between people who may look different. Notably, therefore, race is a social construct. That means that as a society, we have both the knowledge and the capacity to change disparate outcomes, however persistent they may seem. That means that we have to apply what we know and to persistently address the key drivers, which are the social and structural determinants of health. Essentially, what we have to do is to connect the dots. As we prepare for Mayor Bowser's third National Maternal and Infant Health Summit, we thought that it might be important to think about what our individual and collective roles are as we think about maternal and infant health. I like to say that health equity is everybody's work. We know that interventions that target multiple determinants of health are needed to improve health and achieve health for all. What I've done, therefore, is that I've invited several colleagues of mine who have been working with us at the Department of Health and the Office for Health Equity to think in a collective fashion how we could solve problems specifically as they relate to maternal and child health and housing. I'd like to introduce to you at this point Dr. Anital Turkle, who is the Division Chief for Paternal and Infant Health at DC Health, as well as Ms. Rory Durham, who is the Supervisory Coordinator at the Department of Human Services, as well as Ms. Brittany Hanna, who works in the Community of Hope. So these ladies work with me, and we really have built a strong collaborative partnership along with several others as we try to figure out how we would integrate some of our dialogue and discussion through the lens of health equity. What that means is that we have to think about using the data and the information and the best practices that we know, that the determinants of health are such that the non-clinical determinants, as shown on the screen, are the biggest drivers of health outcomes. Clinical care only drives 20%. That means that health is more than healthcare. Health inequities are neither natural nor inevitable. Your zip code may be more important than your genetic code for health. The choices we make are shaped by the choices we have. Structural racism acts as a force in the distribution of opportunities for health. And therefore, more than anything else, we know that all policy is health policy. This is the framework through which we produced the Health Equity Report for the District of Columbia in 2018. And this is really the lens through which we think about how we will improve health together, not just through a healthcare lens, but through what we call the 9 key drivers of opportunities for health in the district, including education, employment, income, housing, transportation, the food environment, medical care, the outdoor environment, as well as community safety. This is a very broad framework. And with that, I'd like to introduce Dr. Turkle, who will talk about the framework for improving maternal and infant health in the district. Dr. Turkle?
Thank you, Dr. Arno. So at DC Health, we have a 7 core priority approach and strategy for how we look at and try to work to improve perinatal health outcomes. And so for this approach, we start at the very top of the circle, at that pink circle, and our first core priority is just making sure that every teenage girl and woman in DC is in control of her reproductive health. From there, we move to looking at every pregnant woman and making sure that she receives patient-centered, high-quality perinatal care that starts in that first trimester and continues throughout the pregnancy and after the birth. From there, we look at every healthcare provider and making sure that every provider has the tools and the resources they need to be able to provide the best quality care and also be able to manage the complex social needs of women and infants. From there, we move to looking at every healthcare facility and making sure that they are providing maternal and infant health care and have access to the tools and resources they need to be able to practice evidence-based healthcare and to document QA and QI activities. From there, we look at every newborn and making sure that every newborn in the district is receiving the highest quality neonatal care, both inpatient at the hospital as well as outpatient. From there, we look at every parent and just making sure that every parent has the life skills they need to nurture and provide for their families. And from the parent, we move to the family unit and making sure that every infant, mom, and dad has a safe and healthy environment to thrive and receive the support they need to be able to promote early childhood development and learning. And so just looking at all of those circles together, we take our perinatal approach to work across the life course because we recognize that so much of the determinants of health are things that are in play even prior to conception.
Thank you, Dr. Turkle. What we want to do now is just very quickly tell you a little bit about the Calling All Sectors initiative that we're working together on. As you can see, we start off with the 9 key drivers of health. We've really looking to link healthcare and housing. We're talking about taking us through an equity-informed collaborative approach to multi-sector health in all policies. We're thinking about how housing and healthcare work together to create opportunities for health, especially through the lens of pregnant women. And so we're really looking at the intersection of housing and pregnancy. What we're really concerned about, however, is that we look to address housing insecurity during pregnancy, which we know is one of the drivers of poor maternal and infant health outcomes. And so that's a lot of what we're doing. Our goals in the project are to understand the impact of housing as a contributing factor to perinatal and infant health outcomes in the district, to better coordinate systems that work with pregnant women and parenting individuals, including young parents and parenting families who seek housing services in the district. And ultimately, our goal is to prevent and ameliorate housing insecurities' impact on maternal and infant health. So that's our overarching goal. And what we've done is we've convened not just the representatives we have here, but we are engaged with the Interagency Council on the Homeless, the Housing Authority, the District Housing and Community Development Department will be joining us shortly. We're engaged with Thrive by 5, as well as Community of Hope. And Community of Hope really has a special role because they're bringing to the table the knowledge and understanding of what it is like to do this kind of work in the community as a nonprofit. So their role is to engage other community partners who are like themselves and to be the voice for community partners and residents who experience this kind of dilemma through the process. So now we are going to basically have a series of questions, and I'd like to kind of tee it up from the Health Equity Report perspective. We knew before we started this project in October 2019, for example, that there was a difference in housing cost burden across the district. For example, in Capitol Hill, 20% of residents spend more than 35% of their income on housing, compared to 60% of residents in historic Anacostia. That means that residents in these different communities have significantly different amounts of resources to spend on other things, including their health when they're pregnant. We know also that there is homelessness in the district, and we had something like 1,166 homeless families, which consisted of nearly 4,000 family members, of which 60% were children. And we know also that infant mortality has been a persistent problem. And even though we have seen improvements, we still have a significant disparity if we look at it through the lens of race. While 11% of African-American mothers experienced infant mortality, the rates for Hispanic residents was 4% and just 2% for non-Hispanic whites. Bottom line from the Health Equity Report is that there's a 21-year difference in life expectancy at birth in the district, and overall, there are differential opportunities for health across the 51 statistical neighborhoods by income, place, and race. So, my question to our panelists are, prior to your engagement in this initiative, how much was homelessness, housing insecurity, and their impact on pregnancy and maternal and infant mortality and health part of your program of work? And I invite each of you to kind of chime in as you consider appropriate.
Well, I can start, Dr. Arnaud. The Department of Human Services has the responsibility of being the gatekeeper, the first point of contact for families that are experiencing housing insecurity. So housing has been the forefront of our service. However, the maternal health and infant health is somewhat new as an integral part of the services that we provide. We do provide shelter services to families who are eligible for homeless services and in that third trimester of pregnancy. But the other persons who have not yet reached that third trimester, we provide community resources and referrals. So now connecting the dots, as you said, this helps us to take a clear, a wider picture of who our service population really is.
Thank you, Rory.
Sure.
Brittany?
Thank you, Dr. Arnaud. With Community of Hope, we have a strong focus on maternal and child health. We have an administration that's dedicated to that under our health administration. As you probably know, as DC Health, we have reports and projects that we do by way of Healthy Start. So I'll say for integration and housing and maternal and child health specifically, we're really committed to looking at that integration and how are those outcomes different, right, for families that are perhaps going through permanent supportive housing that now have the support of a maternal and child health specialist. Our assumption is that outcomes are better. Families are better off with those integrations. So we're really looking at, through our strategic planning and evaluation efforts across 2020 and 2024, the next 4 or 5 years, we're really looking into measuring that impact of collaboration. And I think this group is a great forum to think about how that looks across both Community of Hope and all of our respective organizations.
Great, thank you. And Dr. Turkle?
Yeah, I think prior to this work, we have looked at housing and having housing issues addressed through wraparound services and different case management, home visiting services that we invest in, like Community of Hope, Mary Center. But I think what this initiative has helped do is even just to bring us much closer together with the folks who are in the housing space to just be able to dialogue, understand where each other are coming from a little bit more. and I think build those bridges to be able to have that greater understanding.
Okay, great. Well, I think what I'm hearing from all of you is that prior to now, housing, and we know that's why we set up the project, housing and perinatal and infant health have existed in separate silos. We've historically operated differently. We've not necessarily always considered, and I think Rory spoke to that a little bit about how that works. What are we thinking? How can we work to break down the silos more effectively to protect mothers and babies in the District of Columbia?
I'll take that one, Dr. Arno. Mm-hmm. I think I'll approach this from a data and evaluation type perspective. I know a lot of the panelists will have the programming side of it, but I think one approach to breaking out of silos is aligning the information that we capture on mothers and babies. That information that tells us about their successes and challenges, and information specific to their households that may allude to those health inequities across the district. What I mean by that more specifically is, as organizations, we need to look at the indicators that we've developed at our respective organizations across our departments, and be more intentional about those main data elements that we need to capture across these silos. This information pretty much tells us whether or not a mother in permanent supportive housing is also receiving that prenatal care. And in addition to that, what information do we need to capture across health and housing that tell us that these integrated services are in fact producing better outcomes? And I think as a higher level, thinking about how do we align what's being captured at Community of Hope, what's being captured at DHS, right? Align those data points across the organizations in the district so that we understand from a citywide systems perspective how our services may be better improved to better the outcomes for mom and babies. And again, I think the Calling All Sectors initiatives is the perfect platform to develop this framework and to understand collective impact. I'll also say with regard to racial equity, at Community of Hope, our approach to strategic planning and performance measurement is constantly through our racial equity lens, right? So in our strategic plan for the next 4 or 5 years, one of our goals is to improve health and eliminate inequities in health outcomes in under-resourced communities in DC. So as an objective, we want to specifically improve maternal and child health, particularly for families of color, by specifically calling out that improvement of maternal and child health for families of color, right? In our strategic plan, we're highlighting the importance of racial equity in our programming, health and housing, and in performance measurement. And I think bringing that perspective to this group and sharing those types of best practices and methodologies help us to build this racial equity lens into maternal and child health and housing across the district.
Okay. Well, thank you, Brittany, for bringing that up. I'm going to pivot a little bit, but in the spirit of the same question that we're working on right now. When we started this initiative back in October 2019, there was no COVID or coronavirus on the map. How has the implementation or addressing or adjustment to COVID-19 informed your understanding, analysis, and process as it relates to both housing as well as maternal and infant health specifically? And I'll ask any one of you to respond.
I'll take that. I mean, I think for us as a community, and I think just looking at what's happening in front of us with everything as it unfolds, I feel like COVID has really brought to the forefront what inequity does, what happens when decades, generations worth of inequity is left to fester without those safety nets being strengthened and in place for when these kind of catastrophes happen. And I feel like everything that we see is really the culmination and everything just coming to that final center of seeing how, lack of having a community that is predominantly Black, 40% Black population in the District of Columbia, a community that has just not been given and afforded those access points to education, to equitable employment opportunities, transport, everything that was in the health equity report. And we see how when there is something that happens that affects a community, how not having those systems in place really just come to a crescendo. And I think COVID has really brought that so much closer to home in seeing why it's so important to actually make sure that we are addressing, as a community, as a society, as a government, as a people, making sure that those things are in place so that we are taking care of each other and we are ready for when things do happen.
Okay. Well, thank you so much, Dr. Turkle. Anything else to add, either Rory or Brittany, or before we get to our next question?
No.
Any surprises? Okay. All right. So I think in the same spirit, what we are trying to do in this project is to really think about a systems approach and systems change. How do you think this approach we are applying in Calling All Sectors helps us to think differently about systems and how they work or don't, as the case may be?
Dr. Arno, if I could respond to that.
Mm-hmm.
Through the collaborative partnerships with the Department of Health, the Executive Office of the Mayor, Community of Hope, and Thrive by Five, just to name a few, as well as DCHD, I think that we have been able to unify our approach to services. And it's also allowed us to identify persons who are pregnant as a different population, to where we may have identified them as part of a population, a family, or someone experiencing health. We were working in those silos. I do believe that this partnership has allowed us to establish a systemic relationship and also an understanding to increase the stability as it relates to medical health, as it relates to housing and racial equity. I also think that through this collaborative effort between these agencies, government and non-government, that we have been able, I can speak for DHS, we've been able to identify new data points. And with those data points, assessing and really determining how many families or persons who are pregnant come through our doors seeking services. And of those families, how many can we place into, or how many are eligible for homeless services and need shelter placement? And those who are not yet eligible for homeless services, but we still can refer them to our community partners. And I think it's made us more aware of the delicate nature of a person that's pregnant and how the impact of housing and socioeconomic status, and as you mentioned earlier, your zip code, how that really affects your maternal and infant health. So this partnership has systemically connected us, but it's also systemically allowed us to connect to the persons that we're serving in a more unified approach.
Okay, thank you. So we've talked now about health equity. We've talked about perinatal health. In the DC Perinatal Health Report 2018, we noted there were several interrelated pressing issues that are driving, even before COVID, some of the inequitable outcomes. And they included preterm births, low birth weight babies, as well as infant mortality, which we've talked about before, as well as not enough folks participating in perinatal health and perinatal care. What changes do we need, do you think, in order for us to improve maternal and infant health for all district residents and to improve outcomes?
So I can take that one, Dr. Arno. So I think that with maternal and infant health care, and even when we think about the approach that we went over a little bit earlier, for DC Health, I think we are very cognizant of the effect of the social determinants of health on health outcomes. The fact that 80% of our outcomes in health are related to non-clinical drivers. And so for us, I think it's infused in every part of what we do. And that's what's so important, to be able to affect those sorts of changes. I think for everything every program that is in place, we we do take that into account, that we recognize poverty and racism have profound effects on the way that health outcomes come to play. And so we really do try to look at all of those different social determinants of health to be able to build that network and that system, to have it in place so that we are able to better serve. But I think initiatives like this are so important to be able to keep that dialogue going, because I think in health it's very easy. I think we think about it a lot. We have it articulated in our strategy, but it's something that I think it's important for us to keep building bridges and to keep talking, to develop that shared vocabulary that we get when we engage in that collective impact model, and thinking about the shared work that we can do together, and understanding where each other are coming from, and having our priorities interlocked, and seeing that we're all on the same page. And to be able to create this change, we need to work together.
Right. So what I've heard so far from Brittany, we've talked about the importance of systems, the importance of data. What we've heard from Rory is the importance of changing practice, collecting new data. We've talked about the persistence of these outcomes. What I'd like to let's talk about and explore some more is, how can housing support maternal and child health? We know, for example, that stress is one of the things that produces inequitable outcomes. We know that the data shows that preterm births, postpartum problems, as well as intergenerational trauma are some of the, I don't want to call them intangibles, because we know that they occur. How can we more effectively work together going forward, understanding these things, following the evidence, collecting the data, and doing a better job going forward? How can we support your work, Dr. Turkle, in a more kind of concrete way? Are there things that you would like to see us work as a team in this collaborative project that would help you in doing that work?
Yeah, definitely. I think that, for each of these issues, it's one more thing that any person who's lived, if you're a parent, these are all the balls that are flying through the air that you're trying to balance at one time. And I think all of these decisions, looking at housing and making sure that there are systems in place to be able to provide secure and stable resources to just have that be taken care of if it is something that people find themselves in a housing insecure space, is so important, because then it's one less thing that you have to make a choice between, hey, do I have to put this money towards my rent check, or making sure that we have a roof over our head, or do I forego this medical procedure that can extend my life and help me be able to work and take care of my family? Being able to have that kind of support, I think, within the housing space is so important. And especially in the perinatal period, as you brought up, women who are in more housing insecure situations do have higher rates of preterm birth, as well as low birth weight babies. So being able to provide that security really does go a long way. And we see that in the work that we do.
Wonderful. So the final question is, I'll ask each of you, what are you looking forward to in achieving at the end of this collaboration? And I don't want it to end, but we're on a grant. So what do you think we should try to achieve at the end and beyond?
I'll go first, don't mind. As I mentioned earlier, I think this is an opportunity to create those aligned health and housing integration measures across the district. But I also think this is an opportunity to leverage the expertise of all the partners in rethinking data collection and reporting in terms of race equity. I think it's an opportunity for us to bring to the forefront and kind of prioritize mitigating those instances where racial inequities and racism kind of shows up in the data collection and measuring client services. A chance for us to sort of examine those individualized service models and structural inequities that exist within our own organizations that have been there for decades. And I think through this partnership, we're able to have those, robust conversations, come up with strategies and best practices, and take those best practices back to our organizations to apply them in a consistent manner across the district. I also think it's a great opportunity to involve the community and engage the voices of the residents in the community. Through a lot of the community engagement that we're doing with Community of Hope, we're really pulling in pregnant moms to say, hey, what are your needs? What are you feeling that is missing in terms of getting you the services that you need in both housing, health, specifically in perinatal care, all of that, right? So I think it's an opportunity to leverage all of the unique community engagement projects and activities that we have going on at each of our organizations and sharing that information, right? So those are the things that I look forward to achieving through this collaboration.
Great. And Rory?
I think Brittany summed up all of our achievement goals.
Thank you.
I do believe she said it so eloquently, and it is the systemic partnership. And it's through that partnership that we're able to really not work in the silos. We're able to be intentional in the type of services that we're providing this population. Again, I think for so long, we have identified, even with terminology, we've identified pregnant women, but we've identified persons who are pregnant who are experiencing housing instability and may also have some racial inequity. All of those terms are big words, but when you get down to it, it's our responsibility to the citizens of the district. How do we serve you best? And we serve our district residents and our most vulnerable population best when we're all unified and they have access to whatever services and supports they need, not having to go through an intake process that's 2 days or 3 days with the Department of Health and 1 day with DHS, and then to just walk into Community of Hope and get a one-stop shop. And so I think it's our responsibility to make sure that families and persons who are pregnant are aware. And I think this initiative does that. So that's one of the things that I hope to achieve. And also that these relationships that we have formed, it helps us as we move forward to really create a system that meets the needs of all people. That we're really focusing on not just one population, but there are subsets in the larger populations that we serve. And our data helps us generate change. And our experiences from COVID helps us demonstrate change. So all of these relationships, these partnerships, as well as our desire to want best for the people that we serve, I think those are the goals that I expect. That's what I think we're moving towards, because just in this little bit of time, we have learned so much from one another, and we have been able to understand how systems work independently and maybe be able to make some mergers between those systems, which will then, of course, inevitably help those that we serve.
Thank you so much, Rory. Dr. Turkle?
Yeah, I think Rory and Brittany really covered it. But yes, I at least for me, even thus far, I've really enjoyed being able to learn from our partners in the housing space, and even just understanding a little bit more how it works, to go visit Virginia Williams, see what that pathway is that our community experiences when housing insecurity does hit, and how you access those resources, and just even learning the terminology to understand how the system works. And I think us just speaking with each other helps cross-pollinate ideas and see how we can work together even better moving forward. So I look forward to continue just learning from everyone here on the panel and part of the CASI work.
Okay, well, thank you, everybody. This has been a phenomenal panel. In closing, I want to really reiterate that For our communities to be healthy and strong, pregnant people need to be safe and in stable housing. Housing insecurity during pregnancy is associated with being born too soon, and housing instability during pregnancy is also linked to increased need for postpartum care. Therefore, we really need to think about housing as an essential ingredient for safe births and for the long-term growth and security of our community, which is the District of Columbia. With that, as I said before, health equity is really and truly everybody's work. We all have a role to play, either as a consumer or as a participant or in every job that you do in the district. Therefore, I hope that you will join us and fully understand as you come to the Mayor's 3rd annual Maternal and Infant Health Summit that non-clinical determinants of health are a critical part of improving maternal and infant health for everybody in the district. Thank you so much, and have a good and enjoy the conference when you get there. Thanks so much. Bye-bye.